valuable information coming out here from Public Health Director Linda Denorcey. Linda, thank you so much for joining us this morning.
Thank you.
I guess just first of all, we'll jump right into it. Where are we on the testing? What groups are we currently testing as of today?
Yes, today, actually, we tested yesterday, and we're all caught up as far as 20 tests were conducted yesterday, and 2 came out positive and 18 were negative.
Right, Linda, and I guess
And as far as the testing is concerned, the test kits, we have about 348 remaining, and we should be getting another shipment coming in this week.
I guess this first question, we noticed that last week and I think the week prior, we kind of got used to you guys running the 40 tests a day, and so Saturday, Sunday, and then yesterday we've only run
around 20.
20. So can you explain that?
That's what we're getting from the community at this point. So we're just running them as we get them. So, we haven't gotten 40 so far, and some, it's slowing down. So we just are running them as we get them, Monday through Sunday.
When you say 20, that's just from the limited priority group?
That's for pretty much the priority group as far as we're concerned. And if there's anyone that is going to be run, we wait and we prioritize them. But that would be inclusive of what we have.
So you mean to tell me in this time of mandatory social isolation and quarantine, we're being told that, it could get really scary, that clinics, is that where we're seeing it, that they're not testing people? We're really only testing 20 people a day? I mean,
no, the test can be up to 40, but right now the specimen samples that we're getting, we're running them in accordance to what we're getting. And recently I just sent out a memo. MIT Medicaid is also covering it directly, and they're being paid by MIT Medicaid. So DLS is also going to be running those tests, and we notified that to the providers to let them know that. So DLS is also contracted with us, helping us to get those tests done, and those tests will be done also through off-island, either at the Quest, which is in California, or through Hawaii.
Do you know what the turnaround time for those tests will be with DLS?
Yeah, it will be about 5 days because they're going off-island versus what we have here in Guam, which would be about 24 to 48 hours.
And what about a backlog? Do we have a backlog of any samples from the clinics or anywhere?
Right now, of course, they have to come through our department. If they have backlogged at their facility and they don't give it to us, then we wouldn't have that information. So currently, as of yesterday, I contacted my staff, and they have about a couple to run this morning, about 18, I believe, and that's what they're waiting for more as they arrive, and so that's where we're at.
And so if we already have 18 to be run this morning and we get more, are we going to end up running the 2 batches?
Yes, that is correct.
Okay.
I did want to follow up on Saipan. If you have the results from the suspected COVID-19 individual that passed away.
Oh, what happened? We got the specimen sample, but it wasn't secured properly, and so they had to do a re-swab on that patient. So we should be expecting it shortly. So yes, they did do a nasopharyngeal swab. They did another one on that patient that passed away from CNMI.
And Linda, how are we going to juggle what the testing that we need to run here on Guam, and also do the test that Saipan sends over if our capacity is only at 40 a day?
Right now, we could also send it through State Hawaii Lab. The U.S. API is, the affiliate Pacific Islands. And one of the reasons why Guam was selected as a laboratory is because we are also supporting the U.S. API. Otherwise, we may not have been selected. And so our justification on having our test kits and being selected to receive test kits is also based that we are regional laboratory for the Pacific.
So if
And
we're
how we're going to handle it, we will have certain slots. Dr. Thane and I were discussing that. We're reserving maybe about 5 tests for them a day.
So
Okay.
in a perfect world, we'll run 35. 5 will be from Saipan, and then DLS will also be running samples
Yes.
from the clinics.
But you said we were
Yes.
the regional lab, so where else do we receive tests from? Does this include like Palau?
Yes, it will be Palau, Marshall Islands, as well as the Federal States of Micronesia.
I saw something about
Yeah.
Palau. Can you confirm? Is there a positive case there, as far as you know?
For Palau, no, not that I'm aware of.
Okay.
Most of them are CNMI that we've received
Okay.
so far.
There was a release from Palau, but I think it was that it was suspected COVID.
Okay, and then the tests were sent to public health.
I have
If
to
you-
verify that with my staff because we receive so many spends every day.
Right.
So I have to get a specific. Right now we're having a different reporting for the CNMI and the U.S. API, and we're going to be distinguishing where all the tests that are done, so that we can segregate those out from our count. And that's what we've been doing. We've been segregating them from our count.
So, Linda, have you been getting samples from Marshall Islands and FSM and stuff, or no?
Not right now. The ones that I know of, again, are from CNMI. But again, I will look into that to make certain.
I also wanted to follow up on, initially when news was breaking about the USS Theodore Roosevelt, numbers were coming out of the JIC providing information that there were like 2 confirmed or whatever the number was at the time. And you mentioned on our show that it's required by law that the military has to report their cases, I guess, to you. And now we're not seeing this information from the Joint Information Center releases. So I'm wondering, what was the change?
Oh no, as the governor had indicated, they are handling their own testing, and this is a test that they're doing, and
No,
they're
I
not
understand that
sure.
because they were handling the testing even
you
prior
can
when the information was released through the
Yeah.
Joint Information Center.
Right.
And do they still report it to you or to your agency in terms of the number of confirmed cases they may have?
Right now, I haven't gotten any information on that. So can you just allow me to contact my epidemiologist if there are any updates? But theoretically, I think that's something that you should ask Admiral Manoni at this point in time, specifically about the military.
Right, I wouldn't
Right,
be
right.
asking
Yeah.
if
I
we
mean,
weren't
but-
getting any response.
But Linda,
Oh,
if you said the law
I
is
don't-
that he's supposed to report it to you, I mean, shouldn't you be asking the admiral to report it to you? Or I mean, the governor
No,
calls the
I
admiral
don't.
every day.
Yeah, right now, again, as I speak, the ones that we got reported were the ones that went to the Naval Hospital and the ones that got the results back, and we included that in our figures. Of course, there were 2 positive cases at that time. So that's the one I'm getting from the Naval Hospital, and they do reside in Guam. So that's all the information I have as of today.
Okay.
Linda, how do we reconcile asking the community to, do the social distancing and the mandatory quarantine and to do all the measures to flatten the curve? And then if, the governor and you guys have routinely said that the way to flatten the curve is by doing a lot of testing, but we're only testing 20 people a day. I mean, is that problematic to you?
Hopefully no, it's not problematic with the testing. Hopefully we'll get more samples and also realize that there are, the providers are very much aware that commercial testing is also occurring. And so with these commercial testing, that would help to alleviate more of the testing that is being done just at public health. So I just wanted you to be aware of that.
Okay, Linda, when the commercial testing gets done, would you guys then include that in the results and reporting out?
Yes, every report is going to have to funnel through the department, whether or not it's done by the private providers. through DLS, Diagnostic Laboratory Services. The report eventually has to come through DLS and, of course, Public Health. And so that is mandatory. Yes.
There was something that I was reading. It was one of the FEMA, I think, bulletins, and they were talking about community test facilities. Do you have any information about that?
Community test facility?
Right. I think it was a FEMA.
Mm-hmm. Well, again, community test facilities could be, the hospital. Here at Public Health,
Okay.
the Department of Public Health, it could also be DLS, which is a laboratory that can conduct the testing. So I believe that's what they mean.
Okay. Yeah, I was wondering. about
Linda,
that.
are there any plans to increase the testing criteria and expand it to those who have come into contact with COVID positive patients who don't necessarily meet the limited priority categories?
There may be a possibility in the long run, but right now, as we stand, the advisory council has selected those 4 top priority groups, which I've already announced to you what they were. And right now, as we stand, things change. CDC's guidelines continue to change. And as we journey through, there is that possibility. I don't want to say no, but anything is possible at this point in time. Things keep changing. So I like to say that there's a possibility it may expand. At this point in time, however, we're looking at the priority groups.
Where are we with the not home isolation, the isolation facility in one of the hotels, and has that been stood up yet?
Yes, by tomorrow it will be open, and yes, we have already made arrangements, and we are already ready to get it up in operation by tomorrow.
Mm-hmm. And you were talking about last time we spoke about it's voluntary for the people that are in home isolation, and you guys were working to, I guess, persuade them to go into this isolation facility.
Yes.
How successful have you been, and how many people are you anticipating come tomorrow to move these home isolation patients into this isolation facility?
Yes, I can answer that question. Again, the home isolation, is those that are asymptomatic, just to, clarify.
Okay.
Asymptomatic or they're mild illnesses. And so they don't have to be hospitalized or they don't require any acute type of care services. And so we do say that home isolation is possible, but we have to assess the home. In other words, are there other people living in that home? And does that COVID positive patient also have their own bathroom, their own bedroom? And are they living with other people like the elderly or those that have comorbid conditions? And if so, then that would not be an ideal setting. So they would have to move to our designated government facility for the isolation. And in that regards, right now, we have about 8 ready to move tomorrow. So 3 are coming from GMH and 5 from those that are currently identified as we speak.
Linda, are the a lot of the people that when you go out and assess these homes, are they substandard in terms of they don't meet the criteria that you guys have for home isolation?
Yeah, like I said, it will be our investigators that would do this, and also our surveillance team that would go out and assess. If they are in substandard homes, then obviously we're going to have to move them. And again, they have to be isolated with their own bathroom, their own bedroom. So if some of them may be in substandard homes, if they are, then we will not allow it and we will move them.
I mean, I don't even know the right word, substandard, because like for example, my place, we don't have a separate bathroom, so
yeah,
anything
and
would
then
happen.
We assess too, are you living with other people like the elderly or the comorbid conditions, with those with comorbid conditions? And if so, then that would not be an ideal setting. So those are the protocols that we have in place. So obviously, if you're not in that condition, then and you're a COVID positive person, then we will move you to the designated government facility for isolation.
I wanted to also ask you about the quarantine of passengers, the ones that are in the designated quarantine facilities. A lot of them, I believe, are scheduled to be, their quarantine would be up tomorrow. Is that correct?
That's That is correct, April. Yes.
Okay. And if you could kind of explain the petition that was filed.
Yes, yes. The petition has already been filed in court, and that has already been issued. And what happens is we have to have what is called a petition for order authorizing the continued detention for isolation or quarantine, and that's when the quarantine or isolation is refused. And so this is particularly the one that was filed is for travelers arriving in Guam from Manila, the Philippines, on March 19. And so they're the respondents, and I will appear in court. I'm due to appear in court sometime this week. And what this means is that I will appear and, on behalf of the Department of Public Health, indicate that I'm authorized by Title 10, Guam Code Annotated, Chapter 3, Article 3 of Chapter 19, and as well as Article 6, to take action to protect our island, public safety and welfare. And then this court is just to emphasize that we issued the involuntary isolation, quarantine, detaining these passengers that came from Manila because they pose a threat to the health and safety and welfare. And so I'll justify in front of the judge or the court, indicating why those are in place. And because Guam is receiving a lot of positive cases, specifically from Philippines, and Philippines is really a hot spot, meaning that a lot of the infected COVID positive patients are coming from that area, and I need to justify that. We are quarantining them for 14 days so that they don't pose a threat to our island community. And so by segregating them out in the community, this will allow us to monitor them in a least restrictive area. And so that is what I'm going to say. And of course, indicating these things because of the fact that there's also COVID indication that is occurring in the Philippines, and it has been fatal there. And then their president in the Philippines had also declared that they intended to close the airports and so forth. And moving in line with that, we have to emphasize that we too at the department are doing our surveillance and contact following up. And when we do that, we want to monitor all those households that are COVID positive and also the close contacts. And by having all these passengers continually coming into our island and being infused into our population, it makes it much more difficult, and the possibility of community transmission, and there's no containment of that infection. That is very likely if we keep having people keep coming into our island from hotspots. I hope that answers your question.
So this is just for the passengers that arrived from the Philippines on March 19th, right?
Yes, that is correct.
Okay.
That is what the directive of this proceeding, this special proceeding case, is for those travelers on the Manila Philippines flight, March 19th.
Linda, there was something that we saw nationally. I think the governor of Illinois had said that infant had passed away due to COVID-19 complications. With that news coming out, because that kind of does seem like a new development, is there any more priority being placed on the movement of the maternity ward and the neonatal ICU at the Guam Memorial Hospital because of this development?
That question I would defer to Lillian. Maybe you can ask Lillian about that.
Mm-hmm.
She's more in that realm to answer that question, so I don't want to say anything at this point.
I'm sorry, but I wanted to go back to the quarantine issue, and because we had received information and confirmation actually from the governor's office regarding a patient or a passenger that was at one of the quarantine facilities that was exhibiting signs and symptoms of COVID and was transported to the Guam Memorial Hospital and is listed as a PUI. Do you have any information about that? And what are you guys doing, I guess, to maybe even look into contacts over at that quarantine facility?
Yes, we're looking into that already, and as we speak, yes, we're assessing all that right now. So if anyone is identified to be COVID positive, there's that likelihood that they will be moved to this area that I indicated, the isolation government facility. And again, we're going to assess that situation.
Linda, have any children been tested for COVID-19 on Guam?
As far as we're concerned, I don't have any figures as far as that is concerned. I'm still showing 0 as far as any COVID positive cases. So again, I'll get specifics as far as if anyone was actually tested. But if they were tested, it would have been a negative at this point, because there's no data to show that there is a positive test. But I'll look into that to verify.
Back to quarantine. Sorry, March 19th. How many passengers are we talking?
Okay. Right now, the involuntary, as we speak, we're looking at. I have it right in front of me. Close to about 49, but that number has dropped a bit because some of them changed their minds. So we're looking at anywhere less than 49 passengers.
Okay.
That is involuntary.
Okay. All right.
Okay, Linda. So you said again we have 300 some. What was it? 325 tests.
We have right now, as we speak. I'm gonna give you the data on that.
Okay.
348 tests remaining. Yeah.
And
we're expecting one. We're expecting a test kit delivery sometime this week.
And that's the
yeah,
box.
I don't know how many are coming because we always ask for 4 boxes, but we only get 1. So hopefully we'll see when we get it.
And how much is in a box?
Usually because it ranges, right? In the first time that we had the box, it's about close to about 400, but we had to use some of that to calibrate, revalidate the test kit. So we use some of that. So we were saying on the average about, just to be safe, anywhere between 200 to 400. So at this point in time, with the other kits coming in, that this is the second box we're opening, we're looking at about 300 to 400. And so that's where it's at right now, about that amount.
Is there also any new update on last time we spoke you were mentioning how you guys were working on emergency SNAP benefits, I believe, to prepare for the surge of people that have been impacted financially?
Yeah, right now my staff are looking into that as far as we're concerned. I know for sure that the SNAP benefits have remained, that they can extend for 6 months. They're still in discussion with that, especially with the Medicaid, other than the SNAP. But going back to the SNAP, we're looking into that right now in terms of the employment, and we'll get back to you because that's still under discussion with my staff and FNS, the Food Nutrition Services.
Yeah, because you would think that you guys would be bracing yourself for a flood of people that would want to come in and apply.
Right. Yeah.
Right.
Where are we with that program with the federal emergency declaration, right? So I know that the governor said we're going to have all these different programs available. Is one of those programs emergency food stamps for people who don't normally qualify for food stamps or SNAP benefits? Yeah,
that's the one that I think Sabrina was alluding to. We're looking into that right now, and again, there's some questions that have to be answered. So we'll get back to you on that. Usually, when we get the answer, we'll shoot out information that will go to the JIC, and then the JIC will funnel it out to the community.
Okay, I think that's about it. But just going back to the military thing, so I know that earlier you had said that they were obligated to report it to you, any cases to you as the Chief Public Health Officer of Guam, but are you now saying that they aren't obligated, they don't have to report it to you, or what?
Well, right now, as we speak, it's not to the Chief Public Health Officer, it's to the Territorial Epidemiologist. Okay. That's where they report it to. So far, we have good contact with the military. Their personnel communicates with our territorial epidemiologists in regards to the naval hospital. Now, again, the Theodore is a separate entity in terms of what is being reported. So again, I don't have any information that I can share regarding the Theodore. The
So,
only thing
Linda,
But
I'm getting what you're saying is basically that because if they have positive cases at Naval Hospital, then they're obligated to kind of report
Yeah.
it. But since the Theodore Roosevelt is in a gray area because it's a
Correct.
ship that's docked here, you don't know if it necessarily falls under that category where they
Yeah.
have to.
Yeah.
I see.
At this point in time, that's where I'm going to tell you I only have 2 from Naval Hospital. Okay?
Okay. Thank you for clarifying that, because a
well,
lot
they
of people are out here.
medevaced 4
Right.
to Naval Hospital. And in the press release from the Joint Information Center, when this was all starting to come out, it specified that X amount were from the USS Theodore Roosevelt. So that's why we're just asking for clarification. So
Right.
now we're not going to be getting that information.
Linda?
Yeah.
Hello?
So the only thing that we've gotten are the 2. I'm sorry. The only thing we've gotten are the 2 cases, as I reported, through the military naval hospital, because they are community members. So that has already been given to us at Public Health. So that's all I can tell you at this point in
Right.
time.
What do you think, though? I mean, do those cases from the Theodore Roosevelt, should they count as cases on Guam? Because, aren't they on Guam?
You're asking me this question, and I'm going to tell you that the military is the best place to answer, this type of question, especially in dealing with this particular grayish area. Okay?
All right. Thank
Okay.
you so much, Linda.
Thanks, Linda.
All right. Thank you,
Okay.
too.
Okay.
All right.
Anyway.
Okay.
Okay. Well, yeah. That was Linda Denorcey, Department of Public Health and Social Services, containing COVID. So a lot of information there. I just wanted to hammer down that military thing. I'm not sure what is up with the government of Guam running blocking for the United States military on our island. It's kind of crazy. But yeah, you're right. There was a 180. They came out and we did get information
Yeah,
on
I
these
wanna
Roosevelt
pull that
cases.
up.
And now the
It's-
Navy has said we're not going to put out any more information because of operational security. And it seems like our governor, our elected governor, and our public health director are in lockstep with the military on this.
Or they're not telling her anything, but
Yeah, or they're not telling. I mean, both options are not.
or telling the territorial epidemiologist.
So there you go. 7:29. Let's take a break. We'll do news. Sergeant Paul Tapauza coming up on the show. An increase in crime after 2 weeks of island lockdown. Maybe. We're going to talk to Sergeant Tapau and find out. But I know that the people are starting to WhatsApp me. I just got a WhatsApp